and welcome. Thank you, everyone, for being part of our conversation with community leaders. I'm Carla Banks, the chair of United Way of Greater Greensboro's African American Leadership Affinity Group, also known as AAL. We want you to know, with the community support, AAL has made a tremendous impact within the Greensboro community. These caring community leaders represent more than 100 employers and have helped United Way to raise in excess of $4 million. For the past 14 years, this event has given the entire community an opportunity to focus on a common cause and work together to make our community a better place. Thanks to this event, our African American Male Initiative was established 11 years ago. Nearly 250 adults have mentored more than 250 school kids. This program offers mentor relationships to kids in Wiley Elementary. We follow them through Jackson Middle School and Smith High School. In United Way's current annual report, mentor and former North Carolina A&T State University basketball coach Bill Sutton and his mentee, Dominic, are highlighted. As a result of Bill's support, Dominic will be attending college. In fact, many of the students who started the program in elementary school are going to college, and they credit mentoring as a reason for their success. Today, we are going to build on this impact because in the years past, you will have an opportunity, as in years past, we will give you the opportunity to ask questions and decide how you want to be part of making our community a better place for all residents. This year, we will be challenging ourselves to better understand and define food deserts and what can be done to make an impact where these deserts exist. However, before we continue, we'd like to pause and recognize that we have two genuinely dedicated community leaders, Jamilla Pinder and Paula Seiber, and we have some exceptional sponsors who have made today's event possible. We want to thank our gold sponsor, VF Corporation. Thank you to our silver sponsor, American National Bank and Trust Company. And we also appreciate our bronze sponsors, Cone Health, Greensboro Housing Authority, and Lincoln Financial Group. Pre-COVID, this event was hosted in person. For many of you who were regular attendees, you remember we would get up early in the morning in the very bitter cold and have a fantastic breakfast, but bring everyone together for that common cause that I mentioned before. And that was also an opportunity to encourage attendees to bring winter coats, gloves, socks to support the kids in our community. Since we're meeting virtually, there will be a different way to make a contribution before we conclude today's program, so be sure to stay tuned. At this time, I'd like to share this space with my fellow AAL member, Sharon Dooley. She will highlight United Way of Greater Greensboro's efforts to end poverty and give us an overview of today's event. Sharon?
Thank you, Carla. Hello, I'm Sharon Dooley. It is a true honor to serve as Vice Chair of the African American Leadership Cabinet. Despite being virtual this year, our focus on hosting an engaging and impactful event remains exactly the same. This year's theme is Greensboro Food Deserts, Pitfalls, Partnerships, and Public Participation. As we will learn today, food and a lack of access to healthy food impacts our overall well-being. Basic needs and health are directly tied to United Way of Greater Greensboro's goal to end poverty in our city. A hungry child cannot learn in the classroom, and a hungry and unhealthy adult struggles to find the energy to work. This is exactly why health and nutrition are included in United Way's strategic approach to ending poverty, which includes partnerships designed to help people access healthcare, both physical and behavioral, as well as housing, food, and personal safety. These basic needs are foundational and must be addressed in order for people to find and stay on a path out of poverty. And while they are foundational, United Way's holistic approach also includes supporting educational success, employment, and financial stability. A few months ago, United Way announced a new community-inspired and developed bold goal aimed at taking local efforts of ending poverty to the next level. As a community united in equity and lasting solutions, 3,000 households in Greensboro will leave generational poverty by 2030. The only way we can accomplish this goal is to work together as a community and to address a household's full spectrum of needs. If a mom and dad need employment, we need to help them find a job. If a daughter needs after-school support to improve her grades, we need to do it. And if they all need access to food so they can stay healthy, I think you get it. And that's why we're here today. In a few moments, we will hear from two dynamic community leaders who are tackling the issues of food deserts head on, Jamilla Pinder and Paula Seiber. We want you to leave today's conversation feeling educated and encouraged about what as a community we can do collectively to make a difference. Let's get started by welcoming Jamilla Pinder to the conversation. Jamilla Pinder serves as the Assistant Director of Healthy Communities at Cone Health. The Healthy Communities mission is to improve the health and well-being of underserved residents by offering supports and resources close to their homes and work. Jamilla has been a dedicated employee of, and I'm sorry, excuse me for one moment. Jamilla has been a dedicated employee of Cone Health for over 20 years and has an extensive background working with uninsured and underinsured residing in both Guilford and Rockingham counties. A graduate of North Carolina A&T State University's BS, Bachelor of Science in Agricultural and Environmental Systems, known as Agribusiness and Food Industry Management. Jamilla utilizes her education and her experience to help develop support with local coalitions. Through her work, Jamilla strategically partners with other community-based organizations, healthcare systems, and faith communities to address access care to social detriments of health, which include nutrition, transportation, and housing. Jamilla proudly takes grassroots approach to improving public health by tackling hard to address issues at the block level. Since she's been recognized extensively by so many organizations in our community over the past years for her hands-on approach responding to the COVID-19 pandemic by addressing vaccine myths, providing education, and improving access to vaccines in our community's underserved communities. Jamilla's drive and self-confidence are both inspired by a passage from the book of Psalms. Truth's shining light guides me in my choices and my decisions. The revelation of your word makes my path clear. Jamilla, we welcome you today. We're looking forward to hearing from you today. Now, let's welcome Paula Seiber to the conversation. Paula serves as the Executive Director of the Guilford Urban Initiative. The mission of GUFI is to grow local and urban agriculture, improve community health and wealth while reducing socioeconomic and health disparities, to explore concepts of food sovereignty within an urban setting while promoting food justice, environmental justice, and social justice. Paula Seiber decided to enter the not-for-profit world after the East Greensboro Renaissance Co-op closed years ago. Paula wanted to help get clean housing, clean food, clean water to our most underserved and most vulnerable neighbors. She's decided to especially focus on homeless, seniors, and previously incarcerated residents. Paula started the farmers market on McConnell Road. The market hosts farmers locally and from other areas of the state who bring fresh food every Saturday. The market is one of the community-facing arms of GUFI. It is designed to improve the current food system structural inequities by bringing fresh, whole, affordable foods to local food deserts and offer new commercial outlets for our small farmers of color. She's instrumental in establishing the Peacemaker of Urban Farm Collective. This healthy living and work community collaborative includes UNCG, Tiny Homes Community Development, the Tannenbaum Sternberger Foundation, Walmart, and several others. The goal is to have 16 tiny homes, greenhouses, raised beds, and pollinator areas. These are only a few examples of Paula's passion for making a difference. Paula, we welcome you today, and we're looking forward to hearing and learning from you today. Now I'll turn it back to Carla to kick off our conversation for today.
Thank you, Sharon. This is truly going to be a conversation with community leaders. I'll start off with a few questions for our panelists, and before we wrap up, the audience will have an opportunity to chime in. So if at any time during this program you have a question, please type it in the chat and I'll be sure to share it during the open Q&A portion. Let's get started. Jamilla, Paula, thank you again for joining us. The first question, and whichever wants to chime in first, help us define or better understand what's commonly referred to as a food desert, and how many do you estimate exist in our community?
Both Jamilla and I can answer this one. Jamilla, if you'd like to go first.
That's a good question, because definitions matter. So when you look at a food desert, if you look at the USDA standard of it, it is an area that has limited access to a grocery store within at least about a mile of where someone may live. But again, when you look at the term desert, that's a natural occurring phenom, so to speak. So again, when you're talking about areas where we have, I guess, more concentrated needs, it's more or less, again, looking at the place-based care, so places where structures are that kind of prevent that. So I'd say the last data that I've looked at, we have about 17 true, if you want to use the term food deserts, that are in Greensboro.
And I would like to address the terminology and the verbiage. The label of food desert really upsets me, because a desert, like Jamilla mentioned, a desert is a natural occurrence. It also, when we think of a desert, we think of barren and things not being available. So these, what are called food deserts and labeled food deserts, are truly nutrition deserts. So there's food. They have dollar stores, and we've got Dollar Generals, and and it's high calorie, high filler, and affordable food, and high profit. But there's nothing about that food that is nutritional. And again, it's not. I also get very upset because I believe it's a choice and it's a decision of larger grocery stores to not be in certain areas. So to me, it really isn't just about the food and the nutritional food being available, but it's systemic racism is what it is. So we don't have just our nutrition deserts. We've got systemic racism that we're having to, to work against and to fight. And it's food apartheid. So, and we do have a lot of areas, like Jamilla mentioned, at least 17. And those are just ones that we know of. And also, we were ranked very top in the nation a few years ago. And I wonder if we aren't really still up there. As hard as we're working, people are getting, and certainly with COVID, we've had those numbers are increasing. And are we getting better at reporting those numbers? Or are we actually doing a better job? So I think we need to, that the count is about 17, but it certainly could be challenged, I think.
Yeah, I would agree with Paula with that, because you have concentrated areas. So we do know that there's areas where you have higher concentrations of poverty. But if you take it a step further, what about those numbers that may not be reporting because of, again, when you're getting this data, a lot of it is self-reporting, and then a lot of it isn't. And so being able to really look at where do you typically see, kind of using that observational data as well as that empirical data where you're able to go and truly see this is really happening over here. So you can have an area that could be deemed as under resourced, so to speak, or you can have a resource area and just not be aware that in a neighborhood or community or a block that has a higher concentration of individuals experiencing food insecurity or food hardship. So again, when you look at the data, you have to look at it as a twofold approach of who really is truly experiencing that. So again, like you said, it could be more, 17, or it can be less. But in my opinion, I feel like it's actually more, because when you're truly out there and you're in the margins, you really truly see what's happening. And so being able to look at it from a two-pronged approach.
I'd like to piggyback again. I apologize. And also keep in mind that it's scary as a parent to say that you're hungry and your children are hungry and you can't provide healthy food for your family. There is, the stigma attached to that. Parents don't want to get in trouble with social services that they can't provide for their family. You go to the pediatrician, if you're lucky enough to be able to get to a doctor, and they ask, are you experiencing food insecurity? They may be afraid to tell their doctors. So again, when Jamilla was talking about, what's reported, how many people cannot, and parents and cannot, they're afraid to report, and how many children are afraid to report that they're hungry in school. They're also protecting their parents, and there's a lot of peer pressure at school too. So there's a lot of levels to the reporting process.
Well, thank you, Paula, for bringing to the attention the terminology. So moving forward, we're going to stop using the term food desert. Either it's a food insecurity or a nutritional desert. And then with what you just said, that leads to my next question, what the implications of this can be. So there's the social stigma, there's the systemic racism. Talk a little bit about that from the individual perspective or from a family perspective, as you were just saying.
So it affects so many different parts of our life, right? It affects, and we know that poor nutrition affects our performance. Children are afraid to tell their teachers they're hungry. The peer pressures of being on reduced lunches and, calling children out in that setting. The pressure on parents to provide for their children. Our parents and grandparents, sacrificing their own health and, their own nutrition to perform in the workplace to provide for their children. So it's a lot of this causes a multi-generational issues also. It's hard for me to just there's so many different levels on it. It's kind of, Jamilla, you probably could be more concise than I can with that question.
Well, no, it does go back to, like you talk about, like we just mentioned, the reporting piece of it. So when you look at the shame or the stigma, first it's stigma. And so then you attach shame to it as to, are we creating spaces, and do we have spaces where individuals can go and say, you know, I need help, without taking away the humanity of it, so to speak. And so when you look at individuals who truly are experiencing either food insecurity or food hardship, because again, it goes back to, people have access to food, but do they have access to food that's going to help them prevent sickness and disease or treat their chronic care condition? And so when you look at that, when you look at it across the life cycle, you see, let's say, a pregnant woman, a woman. So you have a pregnant woman who may be experiencing food insecurity. Well, how does that directly impact the growth and development of that child? Well, it causes premature birth, it causes low birth weight, it causes, it can potentially lead to developmental delays, which then we pop up and see when you're looking at children. And so when you look at maybe some behavior issues that are deemed or classified as behavior issues, really are directly impacted as a result of children not being able to have access to healthy food. Then you continue that across the life cycle. So you have children that are going without food. Now we talk about seniors, because seniors are another group or demographic that tend to get overlooked. And so when you look across not being able to start life well, and then how that continues across the life spectrum, that is an issue where it's like, okay, what systems or what policies do we have in place that prevents people from being able to live well? And then when you even break it down a little bit further, where you see who truly experiences more food insecurity and food hardship, you see that more in women, because 9 times out of 10, you have a female that's going to make sure that child is going to have some food, or other members of the household, and then they tend to forget about themselves. And so when you add that into it, but at the end of the day, it all goes back to, do people have we created the conditions for people to live well and be well? And what does that stem to? It stems to, do I have sustainable employment? And in addition to that, so like we mentioned, okay, you can have someone that has a job, I can get a job, but am I having to work 2 or 3 jobs just to be able to make ends meet? And so I have a job, but then how do we take it further? It's, do I have a living wage, so to speak? So I get the job, but I don't have a living wage. That directly impacts the quality of life that someone has. And so at the root of that, you know, food is the core, because you need food. It's the driver, it's the gas, it's the fuel that you need to be able to do what you need. And so all of that has to do with systems. And it looks at policies, it looks at practices, and how are the policies, programs, and practices that we have in place really set up to help people live well. And when we look at some of these policies and practices or these programming, being mindful that you are going to see some just do it's where you have that immediate turn on investment. So yes, I might be dealing with food insecurity or food hardship today, and I'm able to get food, but then what does it look like for the next 4 weeks? What does it look like for the next 6 weeks? And making sure that when we're looking at programming and when we're looking at providing services, how are we truly providing services in a 2 to 3 year time frame? Because the same way I think of it like planting a seed. If I plant a seed today, I'm not going to see a plant tomorrow, right? In order for that plant to be able to grow, I have to nourish it, I have to water it, and know that there are some elements that are natural and then unnatural elements that can contribute to the growth. And so what are things that we need to do? So over time, with sewing in and being dedicated, committed, and then again, looking at what the needs are. So when we talked a little bit about the food deserts, what might work on this side of town is going to be very different from what's going to work on this side of town. And not even side of town, it can be blocks. So if I look at this particular block and this particular group has this need, and we're going to go in and try this intervention with the individual who we're working with, because again, what we think may be a need may not truly be that need. So if we first ask, what is that need that you have and how we can meet that need, then we're able to go in and start addressing some of the other things that may be contributing to factors as to why someone may be experiencing this, or things that we can do that can be contributing to why someone may be experiencing something. Hopefully I answered that correctly.
Well,
like
you certainly both, I'm sorry, go ahead, Paula.
I was going to say, I'd like to piggyback a little bit on that, you know, talking about often women, you know, that are sacrificing for the rest of their family. And you look at a malnourished pregnant woman, And we all know, that malnutrition, you have lower IQ scores, lower performance, chronic diseases, etc. But think of that unborn baby and the growth of the brain in utero in that mother's tummy, that is, and the mother's malnourished. That brain is not getting nourishment to grow. So before even, when we talk from 0 to age 1, that brain triples in size. Well, it can't triple in size without nutrition. And so these poor children, they've got so much ahead of them, because for them to be competitive in school, to be competitive in the workforce, and then to perform in the workforce, to be able to earn a living wage. These growth spurts and the brain development spurts are directly affected by nutrition and healthy food. So just getting some groceries at the dollar store or at a calorie food, high calorie food and filler food, they absolutely, nutritious food is a basic human right. It's not a luxury, and every child deserves healthy food.
Absolutely. Well, you've both given us really concrete context to the issue with respect to food insecurities, what it means, the implications of it, and overall just what we need to think about. This isn't the first conversation. This certainly isn't the first event to focus on this topic. So what would you say is missing from a community standpoint? Is my audio going off? What would you say is missing from a community standpoint to address this issue if you're estimating as many as 17 areas could be tagged as being food insecure, and that's only based on the areas you know of?
You want to go ahead, Paula, or go ahead?
You can go ahead, Jamilla.
You're right, because we've had several conversations. And so it's through the conversations, of course, that we have this awareness. And so through the awareness, sometimes it is like, so what do I do now? So how do you move from awareness to action? And what does that look like? And a lot of it to me is, in my opinion, is sustainability. And it goes back to, like I mentioned, we can meet the immediate need, but how we're addressing the upstream and downstream concurrently. And so, but that happens through sustainability. We will start and may not see like, oh, I'm investing and I'm putting this in and I'm not seeing anything. And then it's not saying we're off to the next thing, but what does it really truly look like to really be consistent and truly present in some of these areas? And so we just mentioned, like we said, if there's 17 areas of need in regards to food, what does it look like for each one of us respectively to say, okay, so if I know hypothetically there's a huge food need on Blue Street, do I live near Blue Street? Do I work near Blue Street? Do I know someone there's at Blue Street? Who can I then connect with over there and truly say, I'm going to commit 1 year or 2 years, and this is what my commitment looks like. So that commitment does look like a financial commitment. That commitment does look like a time commitment. And that commitment also looks at what are some of the resources, or how do you leverage your network of individuals to come and say, we're going to commit to being right here for 2 years or 3 years, and we're truly going to engage. And it goes back to almost how you led with this conversation today. You started with the kids at Wiley, and then you followed them on through middle school, and you followed them on through high school, and now they're in college. And so you take that same approach. So we have all the tools, we have all the resources that we need, and it's not a one size fits all, but looking truly at the dynamics of the culture of where you have some of the higher prevalence of these needs, and really truly say, how can what I have come in and connect to that? Or if I can't do this, who do I know that has that same heart and commitment, or able to come in and be able to plug in, and then maybe I can go over there. And so that's where it's just moving from that awareness to action and really truly saying, how can I commit? So I commit for 1 or 2 years, and this is how I can show up, and this is how I'm able to commit to be able to do that, because you have tons of evidence base that shows that consistency. It's through consistency and gratitude where you're able truly to move the needle and see that sustainable change.
And in addition to that, even smaller commitments, you have extra produce from your garden, or you over purchased at the grocery store. One time I was at the IRC earlier in the summer, and I had a lot of leftover cucumbers and tomatoes, and I took them to the IRC, and one gentleman said to me, "Nobody's ever given us produce." And he lit up, and they ate the tomatoes like it was an apple. The cucumbers just started eating them, and that was just one gesture. So if you can't do 1 and 2 year commitments or even longer commitments, we just have to, even the smaller acts make a big difference in somebody's life.
Okay.
So I
That's
just
a
wanted to
very
add
good
that in
point.
too, because some people cannot do, they're hesitant to commit for a long period of time.
Absolutely. Every little bit helps. So within the theme of today's topic, we are focusing on pitfalls. So we talked a lot about that. The partnerships, I want to move into that realm in terms of each of you and your body of work. Could you give us examples of how you are addressing this void through the work that you're doing each day?
Sure. When you're looking at, I look at it as a harmonious circle, so to speak. So it's continuous and there's no stops in it. And so if it wasn't for partnerships, I know in the work that I do, I wouldn't be able to do the work I'm doing, because everybody brings, I look at it as one body, many parts. We all play a part. And so how do we get all of those parts together to be able to do that? And so an example of some of the work where we're doing that, I look at what we're doing over at the Renaissance, over off of Phillips Avenue, and how we're able to really truly not address only the food need, because again, if you're dealing with food, you're also dealing with other social resource needs. So who needs to be there to kind of make that happen? And so the fact that we have our faith-based partners that work with us. So, looking at how do we integrate more, connect more with our faith-based partners? What does it look like to have, we have the credit union over at the Renaissance. And so by having the credit union, so we have our banking institutions there to be able to help contribute to that. Looking at our partnership with the library, looking at other nonprofit groups that come in and work together. And so nobody has the one answer, but we all have something that we can contribute. And that's one example over in that area where we're able to work together. Whereas maybe over off of Gate City Boulevard or Holden Road or Van Story, there's other partnerships that I work with, again, with food partners, where we're able to say, hey, we have this need, we're doing this. So as we're meeting this need from a medical or health perspective, so you're here at our facility, we're meeting this need, you've identified that you have this need, then what does it look like to be able to say, okay, I have a partner over here that I know, such as, let's say, one step further, where I can say, okay, I'm going to refer you over here, that not only is providing that food need, so we're meeting that immediate food need, but also looking at how do we help you create a system that's going to help you to maintain making sure that you have consistent food, but addressing other issues such as education. Because a lot of what I see in the work that I see and that I do, it is a matter of access and it's a matter of affordability, but it's also a matter of education and information. Some people are just overwhelmed, and because of the stressors of life, when you think of it as toxic stress, I don't know what the next step forward looks like for me. I need to know that I can sit here and pause and take a breath and be able to say, okay, this is what's happening right now, but this is where I need to go. So really helping people walk through that process, because again, when you look at the number of resources that we have in this community, we have a lot of resources, but how do we connect individuals to those resources? And how are we connecting them where we know if I'm going to send you to this agency or this partnership, that I know that we really are going to close the loop in that referral, or we're really going to truly address that need and that people feel comfortable. So again, making sure that we're providing assistance in areas where people feel comfortable. And again, looking at how to remove the shame from this, because once you remove the shame and you really truly can create that condition. And so looking at partners that can come together. And so I know that's very helpful for some of the work that I do off of Colton Road and Van Story, but also off of Phillips Avenue and Bessemer, or when I think about what we're doing over in the Cottage Grove area. Again, it takes all of us to be able to do that. And so it's not just one partner, but it's all of us. And again, I'm all about how do we create those spaces where people feel comfortable with coming and saying, you know what, I truly have a need, and really truly walking people through that process and knowing that sometimes it's not going to be a one and done. Sometimes it takes 3 or 4 or 5 times for it to really click. Because again, like I said, when you're talking about you're dealing with food and you see the physical impact of you not having food and what that does to a person, but think about the mental health component that's associated with that. And I'm pretty sure we've all had moments where we're stressed or overwhelmed and we really truly aren't thinking clearly. So it's not a lack of people don't want to do better. People want to do better, but how do we create the spaces to allow them to be better and really focusing on the mental and physical health base?
Paula, thank you, Jamilla.
Again, I agree with Jamilla on so many levels. Personally, the work that we do, we could not do without the partnerships and collaboration. There is so much work to be done that it mandates those collaborations and those partnerships. I actually, my background picture was deliberate this morning. We could not do what we do without volunteers either. So, it doesn't take, huge amounts of money. Some projects do, but even volunteerism. So the one gentleman holding up the board, he's from the North Carolina Department of Natural Resources, out of the USDA. And then the gentleman on the right, he actually took a day off from John Deere and came out, and they're helping build a greenhouse. So we have had thousands of volunteers and thousands of hours of people contributing. And there's so many intrinsic values that go with intrinsic value that goes into volunteerism, and it becomes a family and it's a team. And so, for example, one project that we were able to do was to purchase 900,000 pounds of fresh, clean produce from farmers of color in North Carolina. That's a lot of food. That's a lot of fresh produce. And with COVID, a lot of our farmers really struggled because they lost their retail accounts, restaurants weren't open and things like that, number one. Also with the PPP loans, et cetera, such a small percentage went to small farmers or farmers of color. I want to say only 1% of those loans that went out to farmers, only 1% went to the farmers that needed it the most. The support went out to your large commercial farmers. So that's one way that we've been working on. And again, that could not happen with all the volunteers to get that food distributed to over 100,000 families that were experiencing hunger. I do feel like sometimes, the work that we do, it's kind of a Band-Aid. We've got a long-term problem, a lot of fixing to do, but we have to, make all these efforts, no matter if it's a day of volunteering or if it's organizing, a multi-million-dollar grant to be able to purchase that food. That also helped save family farmers in North Carolina. We had several farmers that said that project actually saved their farm. So we also want to talk, I think it's important for people to understand where their food is coming from. So when we talk about the fresh nutritional food, and it's traveling on average 1,500 miles to get to Guilford County, how much of that is spoiled and just thrown in the trash before it even gets to a grocery store shelf? And again, we have our nutrition deserts that don't even have the grocery stores for it to get to that shelf. So if we can grow food, so we've been working a lot on, we established a community farm off of Randleman Road and in the Warnersville area. But also to see all the volunteers that said, oh, this isn't that hard. Do you have a couple extra seedlings? So we did grow about 30,000 seedlings and distributed to many other nonprofits and to individuals and to the housing authority and to several people that wanted to at least try to grow their own food, which I think is really important. I also want to point out, the amount of, when we're buying things that are store-bought, it may not be, if it's traveling 1,500 miles, how many preservatives are being put in so it can help make that road trip, how many fertilizers were used to make it faster, and get it to ripen faster or look ripe faster, et cetera. So even, some of our store-bought foods may not be that good for you. So growing food, I think, is really important for people to start at least attempting, or if you know somebody, and share it, just like, we were able to take cucumbers and tomatoes to the IRC type of thing. I'm very pleased to announce a partnership with Guilford County Parks and Rec, and working out at the Guilford County Farm. So one big focus for 2022 will be, they're letting us use 6 acres, and then we are letting us use 2 acres of certified organic land. And all the food and produce that will be grown there will be contributing to children and their families in the public school system that are experiencing hunger. So those are some of the things that our nonprofit has been focusing on. So again, it's the education piece is part of all of this. It's doing. We don't need to study and talk about it anymore. Let's do something. But these, they, again, and it complements. So our programs, what we do complements what Jamilla's doing. And so I've had a lot of pushback in, why are you doing this? Because, Backpacks for Beginning is doing it, and so-and-so is doing it, and so-and-so is doing it. Well, they can't do it all.
Correct.
They can't.
And Paula,
Yeah.
we're gonna keep
Yes.
it moving so we can stay on time, but you referenced the work that you do as a Band-Aid, but our hats go off to both of you, because the work you're doing is more than a Band-Aid. It's necessary, and you are changing lives. So thank you for what you're each doing in your respective areas. But the third component of our theme is public participation. So with that, you offered up volunteerism, the opportunity to maybe be self-sufficient. But if everyone on this call could do 1 or 2 things to address food insecurities, what would each of you suggest? Where could they begin?
I think it's with what we're doing, because many people donate money. And so being able to support programs that are close. So again, you might not have an affinity for seniors, but you have an affinity for children. You may have an affinity for children and vice versa, not for children. And so where do you exercise that ability to be able to sow financially? But in addition to sowing that and sowing financially, it's also your voice, because again, we're having a conversation and you're learning. And so you're learning more about what's happening. So by you now being more informed to make a more informed decision, how do you leverage your voice to say, hey, we really need to do something. And this is how we're able to do that. We have several platforms today that allow us to be able to do that. But how do you leverage your voice in your social circles? How do you leverage your voice in your work setting? You know, because again, when you're looking at companies and working, you're looking at the sustainable, that impact. Sorry, when you're looking at the impact that you're trying to do, that social responsibility is what I was trying to say. So you're looking at social responsibility. How do I use my voice and be that other voice in my organization? And then how am I that other voice in your either faith-based community or religious community to be able to say that, and then take it further, because again, a lot of what we're talking about has to do with policy. So when you're talking about advocacy and policy, how do you leverage your voice to be able to say, this is the reason, this is why we should do this, and this is how we're able to do that? Because there truly is power in numbers. And I can sit here and say, oh, there's a problem over here. Oh, there's a problem over here. There's a problem over there. But then when you come along with me and we're able to say, this is a problem over there, and then you show that I am being present, because again, you invest in what you value. So if I value this and I see the value in this, I'm not just saying it, I'm actually showing up and saying, this is what's valuable to me. So not only you're doing this with your money or your funds, but you're doing this with time, but most importantly, you're doing it with your voice. And so being able to use those channels to really truly say, this is how we can do this, and then get to know more. So again, we've had conversations, we have awareness. So how am I plugging in? And again, if you really truly sit there and pause and think about it, where you are and where you live for that matter, or where you're working that matter, if you really truly just take an inventory, you look around and see what's going on, the answer is always right there in front of us. So again, taking the step of coming from behind our seats and really going outside and saying, hey, I can plug in and this is how I can plug in. So going back to what we talked about a little bit before, it's not necessarily, yes, we have this long-term commitment that you might have, so your strategy, so to speak, but what can I do in the short term? These are short-term things that I can do, because guess what? People experience hunger not seasonally. It's every day. And so every day somebody has a need, and that's every day we have an opportunity to be able to say, I can stand up and be that voice. I can stand up and come alongside you with this journey. And so just looking what's in your neighborhood next door. I mean, an example of that in our communities here, we have neighborhood next door. And so when you look at next door in all of our communities, they are constantly putting posts about, oh, such and such is having this, this is doing this, oh, be aware of that. That's a good starting place to be able to look and see what's happening in your immediate community right where you are. So if you're looking for those kind of starting places of that looking at where can I start there. That's an example of what's happening, getting engaged more. And I understand we all live busy lives and we're all busy. And sometimes it's not for a lack of, we don't care, we don't know. It's how do I take a moment to pause and really look at what's happening around me? And then these are things that I can do within, like I said, within the time that I have, with the resources that I have, with leveraging leveraging my networks that I'm in to be able to say, this is how we're going to do this. And by doing that, I really truly think from an immediate standpoint, we're able to kind of really move the needle on how we address hunger. I was about to say health and hunger, but how we address health and hunger, but then also what it really looks like to do from a long-term standpoint, because again, people are living in conditions that are a direct effect of what has happened from policies from long ago. So even though the policy might be a legal policy or practice, but we're seeing the fruit of that. But we can write that right now today by saying, standing up, advocating, and this is how we make the change.
Perfect. Thank you, Jamilla. Find your voice, advocate, be present, start in your neighborhood. Paula, if you want to tack onto that, then we're going to go to the chat.
Okay, I would like to, so in the area that I live in Greensboro, I have 14 grocery stores to choose from. I have worked closely with the city of Greensboro with planning and zoning, and I know that there has been a lot of efforts to get grocery stores in other areas of Greensboro. They can get a dollar store any day of the week. You cannot get a grocery store. That is also, I think, something we need to, and there was a grocery store that recently opened in Northwest Greensboro. they shall remain nameless. I did some research. They like to open their grocery stores so that they can employ the neighbors. So you can read between those lines. They did not want to employ certain people and certain what they, stereotyped as, a good worker or whatever. So I think too, on some long-term things that we could change is that we really need to work on some of these major grocery stores to get, again, it's just a basic right for all people and all neighborhoods and all, Jamilla has, pinpointed some different neighborhoods. There's a lot of pockets and a lot of places. And so that I think is something, again, using your voice. And if we can somehow come up with a, how to get through to somebody, and I know people have been working for years and we have to keep working on it. We just have to keep working on it. I think also, when we talk about lifespan and the health piece of it, when you look at one of the lowest income zip codes in High Point and the lifespan, average lifespan and life expectancy, and then you go to one of the richest areas in Greensboro, there's a 22-year lifespan. So, we're talking about food insecurities and the nutrition, but the health piece that Jamilla is so instrumental in, coupling her efforts with all the health pieces, we cannot stop thinking about that. And, to even have clinics and doctor's offices and, those medical centers and urgent care centers, they need to be all over Greensboro, and people shouldn't have to be driving 5 and 10 miles to get to one for accessibility. So those are some also areas that we need to really, look at a longer term for solutions and not just applying a Band-Aid, to some of these shorter term things that we're doing. We also, I think, the conversations are critical, like Jamilla said. We've had a lot of volunteers, and I'll be honest with you, they might need a letter for court or something, that's fine, but they never understood how important some of this work is. They may have just come out to the farmer's market, to get some hours for their community service, but they ended up signing up and volunteering 100 hours over because they enjoyed the work so much and getting involved. So there's so many different ways that people can participate.
Thank you. Thank you both. We're going to go to the chat as promised so that we can give the audience an opportunity to be part of the conversation. What are your thoughts regarding the distribution of food that is readily available? Do you think the distribution network is adequate? That question comes from Joyce.
Absolutely not. It's unacceptable, and it's in all caps. It is food apartheid. Plain and simple. Actually, 2 words for it. And guys know how verbose I am. It's food apartheid. Distribution is a major, major problem.
Jamilla, anything to add?
Yeah, I would agree. It's a matter of, do we have the food? We have the food. It's a matter of how do we get the food out? And so that's where I mentioned where we have these pockets. So you might not have a high concentration in some areas, but we have pockets. So how do we leverage or build new relationships? So again, we talk about, the role of the faith-based community partners. We talk about our healthcare centers, and we talk about other nonprofit and non-government agencies that provide these resources. It's, again, when you look at, and I guess I look at things really big like supply chain. And so when you're looking at it like a distribution site, and then it's like, how do I get it out? So I'm the larger distribution, but what does it look like to get out at the neighborhood or the block level? What does it look like? Who needs to be there? And who are we not talking to? Who's not part of these conversations that allows us to, one, storage. So you're talking about cold storage. So if you're talking about increasing fresh produce in a lot of the communities that we're mentioning, well, you have to be able to store that fresh produce, and you have to be able to have cold storage to be able to do that. So yes, being able to have the storage, but then also the transportation to be able to get the food out too. So looking at it as a small ecosystem or a small distribution center to be able to do that. An example, of course, we do in Greensboro now have Second Harvest Food Bank, which is it's a satellite site where you can get food, but then it goes a lot further than that, because you can get there, but again, how do we get the food into the mouths of those that actually need it? And again, looking around and doing that, because it's like that asset building, so to speak, in your community, in your neighborhood. What are those assets, and how do we look at those and leverage some of those partnerships to be able to make sure that we're able to get food closer to where people are, especially if we know that transportation is a barrier. But definitely the distribution is a challenge, but that goes with storage and cold storage, as well as transportation vehicles to be able to get it out to individuals.
And not only the cold storage for that distribution, but even the recipients. I mean, how many people do we have sharing a household? They may not have access to a kitchen. Their refrigerator might be broken. Their stove may be broken. They can't, cook the food that they're given. If we're giving out canned food, can they use a can opener? So that storage and being able to use that food too is also a problem that needs to be addressed. So there's other, not only getting it out to the right people. Yep.
Absolutely.
And then
Multiple layers.
seniors, we often forget about our seniors. So when a lot of benefits got increased because of COVID for children, in order to make those benefits, to get that, to have it available for children, we took away from our seniors. So we may have been, trying to get helping our children, but we were taking away from one group that needs it just as much as the children.
Well, okay, go ahead.
No, go ahead.
Well, no, and I would dare to say take away. I think it's more or less of awareness. So the same way that we have the need with children, we were also, now it's like eyes that see, we're now seeing like, wow, our seniors are also experiencing the same challenge. So what does it look like to not only address the senior need as well as the children? And I feel like we have done, when we talk about that awareness, I think that awareness is happening with the seniors. And so what are things, and there's lots of efforts that have been put into, have we arrived? No, we've not arrived, but are we aware, and is some action to be able to highlight to make sure seniors do have access to food? Yes, we are doing that. Whereas if you would have said this probably about 3 years ago, they were the silent in the community, so to speak, in regards to having this need.
You mentioned earlier, Jamilla, the point of policies that have been kind of the creating the barrier, if you will. So Carrie's asking, what specific policies should we pay attention to with respect to how do we help in this respect?
I believe Paula she spoke of it. So if you were to kind of look at, like, if we were to do a little test real quick and say, think about how many grocery stores are where you live. And like she said, she can count 9 grocery stores. Well, that goes back to zoning. Okay. And that goes back to development. And so being mindful of what zoning is, what zoning means. And then again, when I talk about voice, how do you leverage your voice to be able to go and advocate for individuals that live in high poverty communities, to be able to say, what does zoning mean? What does, development, community development, what does it look like for, if it is a grocery store chain, a larger grocery store chain that happens to come in to a community, what is it still affordable? Because again, it goes back to economics. Do I have stable employment that will allow me to be able to go and purchase food? So I can put 20 grocery stores where we have high concentrations of need, but if people do not have the resources such as the wages, stable employment, that we're still going to continue to deal with the same situation. And so really looking at what does it take? And so, you know, the importance, like we said, when kids have healthy food, they can grow and they can develop and they're able to show up and be their best. That directly impacts the type of employment they have in the future. The same thing with the parents. Like, how do we make sure that people are not working 3 jobs just to make sure ends meet? So again, looking at what does that workforce development and skills look like to be able to help them to be able to get the jobs that will allow them to be able to say, I'm going to go to the grocery store. Because we all know when you have grocery stores or supermarkets, you, the goods are cheaper, you know, versus in an area where you have convenience stores or small stores, you know, the cost of goods are going to be more because you have to offset certain costs. And so you don't have that same buying power that you might have with the larger grocery store. And so again, it goes back to the income gap, so to speak, and again, the education piece. So what does it look like to be able to provide education and skills training that will allow them to be competitive for some of these jobs, that will allow them to have a job that pays more than a living wage?
And another thing that's been brought to my attention since I've been working in these arenas is that too, I never thought about it, that we're trying to attract new businesses and commerce to Guilford County, right? Well, are those facilities going up on a bus route where there's transportation for people that don't have transportation and they rely on mass transit? Or is it just outside the mass transportation, so they can't apply for those jobs? Those jobs are, you know, that new industry's coming. They've got all of these jobs available. Well, they're only available to somebody that has a car, type of thing too. So, you know, that's another way to, when you hear of things like that, you know, happening in Guilford County, you know, to get involved with your city council and to, you know, make sure that your city council members know that you care and that, you know, these things matter. And so I know that there's some efforts in certain of the districts and also with our county commissioners as well. So to make sure that, you know, when we're bringing in new things, that we've got our voices are heard through our city and county leadership as well.
Thank you. In addition to questions, thank you to everyone contributing to the chat. There's some resources also being shared. Lydia posted Little Blue Book and a link to that document. Another question goes back to Paula, what you were talking about earlier as far as self-sufficiency, and Kendra says growing your own food is obviously something she has a passion for, but are there recommendations to help increase more of these self-created gardens in the areas in need?
Absolutely. So, you know, just like with our seedling sharing and teaching our volunteers, not everyone has a yard and a ground plot. One person might have, you know, room to grow tomatoes. Somebody else might have room to grow cucumbers. Well, let's share. There is one community, I believe it's in Virginia, and there's a gentleman that they've done fruit trees in their neighborhood. So instead of, you know, let's also think about, you know, permaculture that provides food for not only, you know, animals and birds and insects, but for people too. And so like this one neighborhood, each person planted a different fruit tree. And so they share with the whole neighborhood, you know, so they all have the fruit, type of thing. Gardening, I've heard so many people say, I can't do it, I don't have a green thumb. Well, they've never tried. And you know what? You got to try. And it's an experimentation, and it depends on your lighting and things like that. But, you know, by promoting growing your own food and being aware of it. So this is a really important facet of why I think it's so important to grow your own food. We have 33,000 new diseases since the introduction of fertilizers and pesticides and herbicides. They haven't been around that long. That's a lot of diseases and a lot of health, care that's needed to combat these, food related and chronic illnesses. So by growing your own food, you know what chemicals you're using, you know what fertilizers you're using too. So I think too, when the education's always a piece of it. If you can't grow it and do it yourself, at least advocate and support other people that are trying to do it. There's a lot of, Lydia is on here. Hi, Lydia. She does, she works with the city, but they've started community gardens at their church, so get involved with your churches. I know that the Greensboro Housing Authority, several of their leaders have reached out and starting community gardens. So wherever you can. I also am lobbying, so hopefully all of you will help me. Atlanta, Georgia got a lot of kudos for having one of the largest food forests in the country. As we are working with the country park area and that whole renovation and the, enhancing that, and we have over 400 acres that we're working with. Atlanta's just using a 12-acre food farm. How many acres can we do? We could do quite a lot. So that's another way to promote the agriculture and the farmaculture. And then with the schools, I know that with Guilford County Schools, we've got a lot of resources that are helping with community gardens at school. Guess what? School isn't in attendance in the peak growing season. So they don't have people to help maintain and nurture those gardens in, June, July, and August when everything could be growing. So thank you for the question about how you can help in, promoting this. There's a lot of ways you can do it on a small basis, just a container on your patio, all the way to helping, for your school that your children are attending, et cetera.
Now, with respect to locations throughout Greensboro or Guilford County for that matter, is there a centralized list? Joyce is wondering, is there a list that actually outlines where food is given away on a weekly basis?
I personally know that, and we work all over Guilford County, so I know that the Greater High Point Food Alliance has a wonderful, wonderful website. And they've got on their menu a list of places, if on their menu on their website, I didn't mean the pun, but they also have a menu or a list of where available food is. I know that is it called Code for Greensboro? They work out of HQ. They are working on an app to get that also for Greensboro, so that we've got a centralized location to list those. And then Jamilla, I believe in the summer, there is an app that people can look for, if I'm not mistaken, for children to be able to go and get foods.
It is, don't quote me, but I can get it to you. I think it's feed, you text feed 211 or something like that. I can get it to you, but there is an app where you can text and it lets you know, and you put in your zip code and it lets you know the areas where food is in the summer feeding food programs. The tricky thing about the resource list is you have it, because before we used to have the blue book and the green book, and I believe we still have some form of that, but things are constantly changing, so it's hard to keep up with those things. And so it's one of those things, like you said, that is a very good resource, the High Point Food Alliance, and it's Guilford County, so it has Greensboro, so it lists all the Greensboro places that you can go and get food. But definitely that's a resource. And again, like I said, the blue book is also a resource, but things are constantly changing in terms of who's providing that. You can also look on websites such as Your Second Harvest or Feeding America. And if you put your zip code in, it will actually show who are those food pantries that are part of Feed America. So that lets you know where in the community that's providing that. But again, outside of Feed America through Second Harvest, there's other, again, I hate to say it, but it's underground, but it really truly is word of mouth. And we have these lists, but the list is constantly changing, or somebody else or other agencies are saying, yes, we want to be able to provide food too. So your non-traditional food pantry partners are changing, which I think is good, because that means you're listening to the landscape of the culture and what's happening in the environment. And so again, that gives others an opportunity to, again, when you're talking about live, work, and play, who else can help provide those resources for people? So those are the spots that I know that I go to, in addition to trying to keep up. I mean, a lot of people have lists, but those lists are forever changing depending on the resources that they have available to be able to sustain the program.
Ladies, we're going to wrap with the final question from our fearless leader of United Way. Our Chief Executive Officer, Kari Garvin, said that he's aware of an experimental collaborative in Central Florida where a new health clinic was built in an impoverished community, and a mini grocery store with fresh produce was introduced as part of the planning. Can you comment on any alternate approaches that can be taken to bring healthier foods to impoverished communities?
Jamilla, you need to talk about what you're working on and what you're doing. Not just working on, she's making it happen.
I like those approaches because, like he mentioned, that is happening in Florida, and we actually have some of that happening in the northwestern part of North Carolina as well. And you do see that in California, where you are, like you said, and down in the southern part of the country as well, more southern. But it is those type of approaches where it's like we show up. And so the fact that it's not just one anchor institution, it's several anchor institutions that are coming together and just saying, we know it's a lot deeper than food. It really truly is, like I mentioned, it goes back to economics. And so what does it look like for us to show up and say, you matter, and we see that you matter, so we are going to plant ourselves in these areas where there are high concentrations of needs. One of the things, I mean, I won't say what we're doing is it's not innovative, but it's a step further. At our Med Center for Women at Cone, where we now have our burrito food program market, where women and pregnant women that have either self-identified or have identified as having a food need are able to come, and they're able to shop in the food market that's at no cost to them, to make sure that they have food that will help either promote healthy pregnancies as well as post-pregnancy. But taking it a step further, like I said, food access is a challenge, but also looking at how are we linking them up to the other resources. So how do we lessen some of that burden for people temporarily while we address those long-term solutions, where those upstream approaches, what happens with policy. So I feel like you see that a lot happening around the country, and I know that those are things that we can do here. He mentioned South Florida, but again, up in the western part of North Carolina, you do have foundations, you have health systems, government agencies coming together to be able to upfit those types of models. And it is an evidence-based model where you're seeing success. So again, I'm all for those types of models, because it takes all of us, because we're all in this community together.
Thank you. I am so appreciative to both of you. You've just been a complete wealth of knowledge. You've given us so much to think about, and so many avenues which we can each decide how we want to now be part of the solution, the public participation portion of our theme. Thank you both for your time, for your knowledge, for your commitment, dedication, and everything that you do each and every day for those of our fellow brothers and sisters in the community who are in that plight of being in a food insecure situation. At this time, we want to share a few ways that we can all do our part to make a difference. I will turn it back over to Sharon to explain.
Thank you so much, Carla. Again, I just want to reiterate, thank you, Jamilla and Paula. If each one of you could please just give them a virtual round of applause. Phenomenal information. So now that we've all been gifted with this great information, how should we respond? We have 3 ways that you can make a big impact. First, we hope that you can share what you've learned today with a coworker, a colleague, a family member, and a friend. Knowledge is power, but unless we share what we know to inspire others, we're going to miss the boat. Secondly, if you represent a local business, an organization, and you are inspired today, we want to know what you're going to do. We want your help. Please respond to today's email that you will be receiving, and let's continue that conversation. And lastly, we'd like to ask you to make a gift to United Way this holiday season that will help to lift local children out of poverty. And I'll add into that is the children, it is the senior citizens. So we want you to help and be able to have a major impact. Normally at our annual Conversations with Community Leaders events, we ask attendees to bring socks and coats to donate to local kids to have during the winter months. Since we were unable to gather coats and socks, we're asking you to get your phones out, and I'm giving you a moment to do that, but we want you to get your phones out today, and like to ask you to text the word LIFT, L-I-F-T, to 40403. Again, you'll get your phones out, and we would love it if you would text the word LIFT, L-I-F-T, to 40403. And whether it's $5, $50, $500, every gift will make an impact on a local child. When you text LIFT to 40403, click on the link. You will be taken to a web page that will offer you optional information and a few examples of the impact you can make. Thank you, Corey. I already see that you got a donation. Jennifer, thank you. Michael, thank you so much. I just want to give you a moment just to get your phones out and start doing that. It's a very simple process. So again, please text the word LIFT to 40403. So whether it's a monetary gift or a gift of our time, any support is appreciated as we all work together to make this community a better place. Both Jamilla and Paula have shared some great ways that you can make that have an impact on our community today and moving forward. So I want you to also please keep a lookout for the email that you will be receiving today as well. I see we have some more donations coming in. Again, a very simple process. The system will walk you through exactly what you need to do. And I see, thank you, Carla, for your donation. And I'm just giving everybody a moment. I see we have some more coming in. Thank you, Joyce. And I'm just hoping today it has been just a wealth of information for you and that you're truly going to be inspired. I just want to reiterate, it is about taking action, be that from a long-term perspective or a short-term perspective. Thank you, Barbara. Thank you, Kristen. This is a wonderful time of giving during this holiday season. Clemente, thank you. Carrie, thank you so much. So again, text the word LIFT, L-I-F-T, to 40403. You're going to see that link and you will be taken to the web page, and it will walk you through and ask you for some additional information, and it's going to let you know how you will be able to have an impact. Thank you so much for those donations that have already come in and that for those that will come in thereafter. Please keep an eye out for the email that you will be receiving today. And this has been recorded as well. We just hope that you will share your learnings today and look for those opportunities. Thank you again for attending today's meeting and for investing in our community. Here's to hoping we will be gathered in person next year. I hope that each one of you will have a terrific day and be safe and happy holidays. Kendra, I see you've got a donation. Thank you. So keep those donations coming in. And again, we just want to thank you for your time today. Have a great day. Be safe and happy holidays. Thank you, everybody. Keep those donations coming in and look for those ways to partner in our communities.